You've reached the age where you learned a thing or two. This is the age of knowing what needs to be done.
Hello, sir. My name is Lisa, and I'll be your nurse today. Unfortunately, the doctor tells me you're not feeling well, and he's diagnosed you with herpes zoster, or shingles, which is caused by the varicella zoster virus. I'm here. I'm going to tell you a little bit about the herpes zoster virus, how to prevent the spread of infection from the herpes zoster virus, and some signs and symptoms to watch out for while this is going on and even after this resolves. And also a little bit about the medications that the doctor has prescribed for you, and answer any questions that you have. First, can you tell me about what was going on with you that brought you in here? What have you been feeling? What's been going on recently?
Well, I've been fairly healthy up till about a few days ago, and then I got this rash on my back and it just started to hurt, so I came to the doctor to see what was going on. I guess I could show it to you.
Can you tell me, how were you feeling before the rash started? Are there any signs and symptoms or pains going on? What was happening medically?
Well, like I said, I was feeling okay, but then a few days ago I started feeling tired and sluggish. Overall, I didn't feel too well, and then I got a headache, and I might even had a fever. Then I got a tingling feeling in my back, and then I noticed I had some blisters and a rash back there, so I came to the doctor to find out what's wrong.
I'm sorry to hear that. Hopefully we'll get you feeling better soon. But let me tell you, those are typical prodrome symptoms of the varicella zoster virus when it reactivates as shingles. First, you feel those typical flu-like symptoms that you feel with so many illnesses and diseases. You feel might have a headache or some muscle aches, feel tired and just sluggish, like you don't want to do anything. You may have a fever, you may not. With the herpes zoster or shingles, you get a rash, or you get usually some strange feelings before the rash occurs, whether it's tingling or numbness, just weird sensations in that area, and then a red rash forms that quickly forms blisters, also called vesicles. And eventually, after about a week, give or take a few days, it will crust or scab over, and eventually then that will resolve on your skin. Once it crusts over, you're no longer contagious.
Can you tell me how I got sick? I mean, I haven't been around too many people. I've just been going from work to home and to here now.
Yes. Well, you weren't given the infection, the varicella zoster virus, at this point. You must have had chickenpox, which is another form of the varicella zoster virus, an illness caused by this virus, that you had and were exposed to as a primary infection as a child. It also, you could have been exposed to it through the chickenpox vaccine, but it's more likely that you were exposed to the natural wild type strain, and that's what was in your nerve cells and lay dormant, and then the varicella zoster virus reactivates in shingles.
So I've been sick the whole time?
No, you haven't been sick. What happens is the varicella zoster virus causes chickenpox, and then the symptoms go away, but it lays dormant or latent or asleep in your neurons or nerve cells. And then under periods of chronic stress, or as your immune system wanes as you get a little older and elderly, or in people who have immunosuppression, such as people who are taking chemotherapy for cancer or chronic corticosteroids that decrease immunity, or have immunosuppressive diseases such as HIV, their immune system doesn't always work as well, and they're more likely to get the reactivation of the latent virus from the neurons back into your skin or epithelial cells in a lytic infection. Luckily, the doctor did a thorough medical history on you, and it seems as if you don't have any of those. So this should resolve and you should heal nicely.
Well, that's good. really hurts.
Well, we're going to try to help that. The doctor has prescribed you an antiviral. Antivirals work against the varicella zoster virus. He's prescribed you a cyclovir. Valacyclovir and famciclovir also worked, but acyclovir is the most common steroid to be used for varicella zoster virus. Luckily, you came in within 72 hours of rash onset, and that's when an antiviral is most effective. The doctor's also prescribed you a corticosteroid to decrease inflammation and hopefully get you feeling better soon. The doctor can also prescribe a pain medication if needed for the pain.
Well, is there anything I could have done to prevent this?
There is a shingles vaccine called Zostavax. It's a potent form of the varicella zoster virus. It's live. It's an attenuated virus. However, it's only recommended and allowed for those over 60 years of age. So unfortunately, you can't get that right now as the regulations stand. However, always taking care of your health and healthy behaviors and wellness activities will keep you free from disease and illness.
Well, what can I do about this rash that I have now?
Well, right now, we can give you some cream and things to make you feel better, but also what you want to do is focus on keeping the rash clean so you don't get an infection and covering it. Covering the rash with a dressing and changing it twice a day, that will prevent anyone from becoming infected from you. The only thing that's infectious or contagious on you is the fluid in the vesicles or blisters. Luckily, as long as you keep them covered, you won't be infectious to anyone or contagious to anyone. Unlike with the chickenpox virus, this is not as easily spread. Chickenpox, a form of the varicella zoster virus, is spread through respiratory droplets or secretions and very contagious. All you have to do is keep it covered, and from anybody who's never had the virus, you should who are susceptible to the virus, you should prevent them from getting infected.
So once the rash goes away, I'm okay?
You should be good to go. However, there is something called post-herpetic neuralgia that I should make you aware of. It's a neuropathic pain or nerve pain, and it can be very chronic and severe and last a long time. So if you feel pain after this rash has gone away, you should come back in right away so we can help you out, assess you, and hopefully give you some medication to make you feel better. But given that you're in relatively good health, you should heal nicely and feel better soon.
Well, that's good to hear. Thank you. I learned a lot today. I think I feel better already.